Hi, good evening, everyone. I am State Representative Deanne Mazzocchi. Welcome to tonight's webinar. Tonight, we're going to be talking about tick-borne diseases and Lyme disease. And unfortunately, whether we're talking about the American dog tick, the Lone Star tick, the black-legged deer tick, there are several different types of varieties of ticks in DuPage County. And you can also go further beyond as you start going into our more rural areas or into our state parks. There are many opportunities where you can encounter ticks and and unfortunately put yourself at risk for tick-borne diseases. So we wanted to make sure we did this webinar tonight to educate you. So hopefully all of you out there have managed to enjoy our lovely forest preserves here in DuPage County. Maybe you've gone to a park or you're just enjoying your backyard or walking through one of our state parks. But in any instance, ticks, when you encounter them, they can be very concerning because they are so well known for carrying the virus that can lead to Lyme disease. So that's why we thought it was important for our residents to know how to protect themselves and how to enjoy the summer safely outdoors. Now, because tick-borne diseases are very important, and our local DuPage County government, in particularly the DuPage County Health Department, they actually do a whole host of monitoring and in connection with disease as well as tick counts to make sure that they're trying to keep us safe. So I've invited for us to enjoy tonight two experts from the DuPage County Health Department. They're going to be offering their insights on ticks and also on preventing Lyme disease. So tonight with us, we have Dr. Rashmi Chugh. She specializes in the treatment of Lyme disease. We also have Harvey Mull with us from tonight, who is an environmental specialist and also a compliance coordinator. I would like to let everybody know that I'm here to serve you. So while I serve on a whole host of committees, we try to do as much as we can to keep our district residents informed on timely issues. So if there are particular issues that you would like to hear more about, we encourage you to reach out to the district office. We do absolutely want to hear from you so that we can make sure that you are getting the services that you need from your state of Illinois government. One of the things that I would like to also let everybody know is that we do have some people who are checking to make sure that if you would like to post comments, either if you're watching us with Facebook Live in the comment boxes below, or alternatively, if you are joining us by Zoom and you'd like to put comments in the Q&A section or in the chat box, just feel free to do that, and we will try to get your questions answered after our two presenters have given their presentations. So with that, I would love to turn the floor over to Harvey, and let's start with you to talk a little bit more about ticks and the DuPage County Health Department and what you guys are doing to try to keep our DuPage County residents safe. Thanks so much.
Thank you, Representative Mazzocchi. And I appreciate you all being here with us this evening to discuss what we can do regarding illnesses that can be transmitted by ticks. Our main concern with ticks right now is Lyme disease, and Dr. Rashmi Chugh, Chief Medical Officer for DuPage County Health Department, will address that shortly. I'm one of the licensed environmental health practitioners at the DuPage County Health Department, and I'd like to start by giving you some background on the ticks that we have here in DuPage County. Thank you. I'll begin by borrowing an illustration from a recent article posted by the Forest Preserve District of DuPage County. This shows 3 of the tick species that are commonly found in DuPage. Ticks emerge from eggs as larvae, and if you look closely and for identification, you can see that the larvae only have 6 legs. But after a blood meal, a tick can advance to its next life stage. Notice that the nymphs and the adults have 8 legs. After the eggs hatch, the larva can go without a meal from a host for up to about 9 months. The ticks take a blood meal and mature from larva to nymph, and they can live over a year without feeding. And then the fully mature adult ticks can also go without a blood meal for over a year. However, it's an essential part of a tick's environment is moisture. Next slide. It's easiest to identify the adult females. Notice the markings on the shield, which is called a scutum, on her back, and the presence or absence of a scallop texture called a festoon on her abdomen. We have all 3 of these tick species in the area. The black-legged tick is the one that can transmit Lyme disease. Now in these photos, the legs and most of the abdomen are grayed out. This is to guide your eye to some of the distinguishing marks. The clearest distinguishing marks are that the black-legged ticks are typically smaller than the other 2. The black-legged tick does not have the textured festoons that the American dog tick and the Lone Star tick have. The Lone Star tick has a white dot on the bottom of her shield, and the American dog tick has mottling on her shield. The black-legged tick is also known as the deer tick. It migrated primarily from the East Coast, but also from Wisconsin. They can transmit the Borrelia organisms that cause Lyme disease, which is our primary tick-borne health hazard. But disease transmissions are possible. The greatest risk of being bitten is in the spring, summer, and fall. However, adult ticks may be out searching for a host anytime the winter temperatures are above freezing. The deer tick life stages that are most likely to bite humans are nymphs and adult females. The smaller ticks, especially the nymphs, can be at a greater risk because they are easy to miss during tick checks. The American dog tick is also known as the wood tick, and it's been around for as long as I can remember. The adult females are the ones that are most likely to bite humans. This tick has been found to transmit tularemia and the Rocky Mountain spotted fever in the western U.S. It can transmit disease after it's bitten an infected small mammal, such as mice, rats, rabbits, possums, chipmunks, and squirrels. But fortunately, the small mammals in DuPage County have not been found to be harboring Rocky Mountain spotted fever. The Lone Star tick is also known as a turkey tick. They're migrating up from southeastern United States. And 20 years ago, they were rare in Indiana, but today they're the most common tick in Indiana. Lone Star ticks are very aggressive ticks that bite humans and you can identify the adult female by the white dot or Lone Star on her back. Lone Star tick saliva can be irritating, but the redness and itching at the bite site does not necessarily indicate an infection. The nymph and the adult females are the ones that most frequently bite humans and transmit disease. This Lone Star tick is relatively new to this area and brings concern about a reaction called acquired red meat allergy. This is an allergy to certain types of meat caused by the bite of a Lone Star tick. The allergic trigger is found in red meat products such as beef, pork, venison, and lamb. So knowing the species of a tick that you find crawling on or biting your child or your pet or yourself can better inform you how to respond. So remember that the 3 tick species can transmit bacterial diseases from animals to humans if they first bite an infected host animal. Before 2005, if a DuPage resident was diagnosed with Lyme disease, it could usually be traced back to an out-of-state tick exposure. But since that time, reports of Lyme disease have increased in the northern half of Illinois. So the takeaway from this is that the black-legged ticks, also known as deer ticks, are the ones that transmit Lyme disease, and the American dog ticks and Lone Star ticks have not been found to carry Lyme disease. Next slide, please. It generally takes several hours for disease-causing bacteria to transmit through an attached tick to a host human. It depends on the pathogen and the research study that you're which research study that you're reading, but the findings often show that it takes about 30 to 48 hours for that transmission to take place. Since the abdomen fills with blood, it's important not to squeeze that blood back through the bite and back into the host when you're removing the tick, and more on that later. Some people ask about testing a tick they find for disease, and you can search online for a phrase like test tick for Lyme disease near me, or just ask at a local pharmacy, and they can provide options. Test kits can cost from $50 to $100 for testing ticks. But if you have been bitten, knowing the species of a tick gives some indication of what to look for after you've washed and disinfected the bite area. Providing species information to your doctor can lead you to the best and quickest advice for next steps. Next slide, please. Here are some local resources for tick identification. You can take the tick specimen or even email photos to a University of Illinois Master Gardener. Their DuPage County branch office is in Naperville. They have limited hours, so it's usually best to call first before dropping off your specimen. If you can take a couple of good, clear, close-up photos showing good detail of the tick, that may be the most expedient way to email, to get your information, to email those photos to the U of I Master Gardener program. Otherwise, you can send the specimen to Illinois Department of Public Health with this completed arthropod identification form that's available from the URL shown below. The form provides details on how to pack the tick in alcohol and ship it to their facilities in Springfield, and then the department will report the species identification back to you. I understand that this presentation will be posted on Representative Mazaki's website for later access to this information. Next slide, please. This illustrates the life cycle of a black-legged tick, again, also known as the deer tick or Ixodes scapularis, and it can live for up to about 2 years. Starting at the center of the illustration spiral, the eggs are usually laid in the spring and hatch in the summer. The ticks need a new host at each stage of their life. Dogs, horses, and sometimes cattle can get Lyme disease and become hosts for these ticks, in addition to the small animals I mentioned earlier. Depending on the season and weather conditions, when the adult ticks feed from their final host, they will nest or begin mating. Males will die after mating with 1 or 2 females, and a female will lay over 1,000 eggs during the spring months. The females die shortly after that. Next slide. Ticks are stealthy. During encounters with ticks in humans, ticks want to find a place where they may not be interrupted during feeding. The 3 main local species that we've been talking about are looking to feed for about a day or 2 and then just drop away from their host. And many tick bites go unnoticed, and many people with tick-borne diseases do not know that they've been bitten by a tick. Questing is the term for when a tick reaches out from a tall vegetation to grab onto a passing host, as shown in the picture here. Most encounters happen when a tick grabs onto a person, often below the knee level, and as the person brushes by the vegetation. Ticks will often explore a person for up to about 2 hours before starting their blood meal. Some species prefer to feed under the cover of a person's hair and are found biting in the scalp. And this is the reason that people may fear that ticks drop out of trees. But ticks do not usually climb trees or drop out of mature trees, and they cannot fly. Excuse me, next slide. So avoid ticks when you can. Keep your lawns and grass and play areas cut to deprive the ticks of the moisture they find in the fallen leaves and the tall grasses. This also eliminates places for ticks to overwinter and lay eggs. Wear light-colored clothing to better see the ticks that are climbing on you. You can also provide a dry barrier of mulch or stone between grown-up areas and your lawn. And do use repellents containing picaridin or up to the 30% DEET. Some other over-the-counter products use an active ingredient called permethrin that you can apply to areas, tents, gaiters that you wrap around your lower legs, and clothing. Always read the label on these products and follow instructions for use specifically against ticks. Permethrin is a man-made synthetic insecticide. Its chemistry is based on natural pyrethrum compounds that come from the flowers of the chrysanthemum plant. It can get into your body by being inhaled, ingested, or absorbed through the skin. So over-the-counter permethrin is generally non-toxic to human, but it can become moderately toxic if overused. Next slide, please. Tucking your lower pant legs into socks or wrapping the Velcro gaiters around your ankles can make a difference as to whether the ticks will travel up your body inside or outside of your clothing. Just remember, check for ticks daily, shower soon after being outdoors, and call your doctor if you get a fever or rash. Next slide, please. Get preventive tick and flea treatment for your pets from your veterinarian. I've found ticks on dogs mostly where they can't reach with their paws or teeth, especially in their ears, on their face, or under their collar. When ticks fall off of whatever or whoever brought them into the house, the good news is that the living areas of your home are inhospitable to ticks due to dryness. Unless they fall into a moist area, ticks usually will not survive in living areas of a house for more than 24 hours after they've dropped off their host. If a problem persists, and again while following label instructions, using a non-toxic to humans indoor flea and tick spray can help treat an area. Other products like peppermint oil can also be effective against ticks. But I should add, do not put products like peppermint oil on your skin or on your pet. Again, stick to the product label. And don't try to use oil, alcohol, matches, a cigarette to remove a biting tick. These methods can cause ticks to regurgitate the contaminated blood back through the bite wound. One more thought, using a clothes dryer will eliminate live ticks from clothing. Next slide. Okay. An unrealistic part of this illustration could be step number one, to actually find a tick biting instead of just crawling on a convenient place like your forearm. But I guess it could happen. I've usually found ticks biting me behind the knees, or on my back above my belt, or in my hairline, or in my hair on the back of my head. And these are places where I might not be able to see tweezers to use them. So it can be a good idea to get help from an assistant with clean tweezers. Grip the tick as close as possible to the mouth, and those are mouth parts that protrude from the body, as you see here, besides the legs. Gently pull the tick until the person's skin starts to stretch, and then hold there, sometimes for up to a minute, until the tick is able to release its bite. This takes a moment because of a tick's serrated mouth parts. And then step 4, wash and disinfect the bite wound. Next slide. At the health department, we invite people in DuPage County to report their encounters with ticks online. DuPage Health Department partners with the DuPage County Information Technology Department, GIS Division, that can do very useful things with maps. And here's a preview of how to get to our tick and dead bird reporting tool that you can access. The DuPage County Health Department uses information collected from residents regarding dead birds observed and ticks sighted in the community as part of our mosquito and tick-borne illness surveillance program. So if you get a chance, please provide details about bird death or tick sightings in DuPage County using the Citizen Reporter link. Be sure to see the bird and tick identification dates provided, and then submit your findings using the Health Reporter button on the URL page. Next slide, please. The Citizen Reporter prompts you for details about your findings. Photos can be attached and are useful, and you have options to click on the map or to use your phone's location to identify the location of your sighting. Your name and phone information are kept confidential. Then data are processed, and then interactive maps appear a few days later on the URL at the bottom of the screen. This website is where DuPage County Health Department also shares current information about West Nile virus. Next slide, please. Next up is our Chief Medical Officer, Dr. Rashmi Chugh. Thank you.
Thank you, Harvey. That was excellent, an excellent overview from the tick perspective. And so now I will sort of segue into the human clinical perspective. So if we could move to the next slide, please. Thank you. So first off, just to share a little bit about what our landscape looks like with regard to human Lyme disease and in DuPage County. And what we have are really our case counts by year, broken down by exposure. And as Harvey had mentioned, since it was 2005, 2006 or so, at least where human exposure, I think, and you're right, Harvey, in 2005, I believe the Borrelia burgdorferi bacteria were identified in ticks locally, and then subsequent to that, human cases were identified in DuPage County residents where no travel outside of DuPage or even outside of Illinois was identified during the case investigation process. So you'll see in this graph over time, not only an overall impressive rise in cases, we're now up to 79 cases in 2021. And in the breakdown, you'll see a growing proportion of cases that did not report exposure outside of DuPage County. Next slide, please. So continuing the brief history, just overall, from a burden of disease perspective, Lyme disease is the most commonly reported tick-borne disease in the United States and in Europe. It was initially identified in Lyme, Connecticut, from where it gets its name, in 1975, in a cluster of children and adults who exhibited arthritis-like symptoms. It's a gram-negative spiral-shaped bacterial species, and Borrelia burgdorferi is the primary causative agent of Lyme disease in North America. It became designated as a nationally notifiable condition in the United States in 1991. And what that really means when a condition becomes a reportable condition or a reportable disease, it means that there is some public health action relevant to the control and prevention of that disease. And Lyme disease is one of those for the many reasons that Harvey just shared and that we'll learn about clinically. So it was designated a nationally notifiable condition in the United States in 1991. It is transmitted primarily through the bite of infected black-legged ticks and is most commonly found in wooded suburban areas and forests, as was shared in DuPage County as well now. And in fact, we continue to learn new things about Lyme disease and its causes. In 2013, a new species of bacteria called Borrelia mayonii was discovered, and this has been identified in northwestern Wisconsin and Minnesota. And in fact, more recently, just this year, the Illinois Department of Public Health Vector Control team did some tick dragging and collected ticks this year that tested positive for Borrelia mayonii in 5 northern Illinois counties, including DuPage, though so far no case in Illinois or no person with Lyme disease in Illinois has been identified with infection of Borrelia mayonii yet, but just good for awareness. So next slide, please. There we go, thanks. So looking at the national landscape, we see based on the darker shaded states that Illinois is fortunately not one of those considered with high incidence, meaning with 10 or more cases per 100,000 population. However, we do have activity at 1.7 cases per 100,000 population. But nonetheless, and here we have on the left a list of states that are considered high incidence, with Pennsylvania being the highest, having a case rate of about 28 times that of Illinois' case rate. But good to know, during travel, especially during these months, but that we do certainly have risk of exposure in DuPage County and in Illinois as well. Next slide, please. So how can Lyme disease be contracted? Transmission, Harvey gave some great examples of questing where they, as he said, they're stealthy. They kind of lurk and hang out, until they can find someone to latch onto, just kind of innocently, passing by. And then how ticks transmit disease, again, they're stealthy, they're strategic. The process is very mechanical, and it's interesting. It's quite a well-designed process, not to our advantage, but to our advantage to be aware, toward early recognition and treatment as needed, and prevention, of course. So the tick secretes saliva with anesthetic properties, so the host cannot feel the bite. So imagine, as Harvey said, often we're not aware of a bite. The tick cuts into the surface of the skin and it inserts its feeding tube, and then it feeds for several days and may become infected with the Lyme disease pathogen. So that's, again, when it bites an infected host. So after feeding, the tick drops off the host and then prepares for the next life stage. And at its next feeding, the tick can then transmit infection to the new host, which could be any one of us. Once infected, a tick can transmit infection throughout its life, and it must be attached, and this is important, it must be attached for 36 to 48 hours or more before Lyme disease can be transmitted. Next slide, please. So the risk of Lyme disease, we're in the middle of it between spring, summer, and fall. We've got a lot of great outdoor activity with, campers, hikers enjoying our DuPage County Forest Preserves locally as well as statewide and nationally. Hunters, outdoor workers, as well as our pets. Various outdoor activities, and even in our own backyards, they can be a setup for exposure to ticks. And In pregnant women, it's especially important to be vigilant because Lyme disease can have severe consequences and can cause infection of the placenta and potentially still can lead to stillbirth. So we want to do everything we can to prevent Lyme disease in everyone, and particularly in pregnant women. Next slide, please. So the symptoms of Lyme disease. So on the left side, we have symptoms related to infection with Borrelia burgdorferi, which is the more common and prevalent source of infection. And then on the right side with Borrelia mayonnae, which was identified more recently in 2013, I believe. And so on the left, actually in blue font, we have the symptoms that are common to both, kind of generalized flu-like symptoms, fever, headache, neck pain, and arthritis. And then what's unique to each is identified in red font. So for example, with Borrelia burgdorferi infection, the erythema migrans is the hallmark symptom, which we'll see some pictures of in a moment. But to meet the Lyme disease criteria, if it's present, it needs to be 5 centimeters or more. And sometimes there can also be other symptoms and manifestations of Lyme disease, such as facial paralysis, leading to a droop, or sometimes even pain, as well as some heart conduction defects that can lead to concerning arrhythmias or irregular heartbeat, fatigue, and muscle and joint aches. And then with Borrelia mayonnae, there may be some GI symptoms manifesting as nausea and vomiting, and there can also be a higher concentration of the bacteria in the blood. Next slide, please. So the way the illness manifests is through 3 clinical phases. If it's not, the earlier it's identified, then the sooner disease progression can be arrested. But just for example, if someone is not treated, it can progress through 3 different phases over time and in severity. Phase 1 is localized early infection, which occurs in the first between 3 to 30 days after exposure, which is the incubation period, meaning the time from exposure to developing symptoms. So that localized early infection is 3 to 30 days after exposure, and we'll talk about that in a little bit more detail in a moment. Phase 2 is early disseminated infection, so that occurs 1 to 2 months after exposure. And then phase 3 is later disseminated infection, which is 2 to 3 months after exposure. So imagine if someone is infected during the summer, then these symptoms may be manifesting in the fall or even early winter. Next slide, please. So in phase 1, localized early infection is just that, where there's erythema migrans, or the bullseye rash, that occurs at the site of the tick bite in 70 to 80% of cases during that 3 to 30 days period after exposure, actually, that should say, with an average of 7 days between exposure to symptom development. It expands over days, and it can be, a foot or larger in diameter, and it can be warm to the touch. Rarely is it itchy or painful. And then it has this kind of bullseye appearance that you see on the right. Not always, but this is kind of the more typical presentation, where the center clears as it enlarges, giving it the bullseye appearance. And then it's often accompanied with other symptoms such as fever, fatigue, and headache. Next slide, please. So phase 2, or early disseminated infection, has 3 different areas of manifestation. One is the skin, where there can be multiple erythema migrans lesions, as you'll see in the photo on the right, or neurologically, it can manifest as, again, that facial palsy or droop, loss of muscle tone or droop on the face. It can also lead to meningitis or central nervous system infection, and then also contributing to problems with short-term memory. And then it can also lead to complications of the heart in Lyme carditis, where it enters the heart tissues and leads to conduction abnormalities, and can also manifest as episodes of dizziness or shortness of breath, And that is thankfully rare, but can be severe and important to recognize and treat. And occurs in 1% of reported cases. Next slide, please. So phase 3, which again is 2 to 3 months or later, is later disseminated infection, and that manifests as in the musculoskeletal system as Lyme arthritis. And it's typically unilateral, meaning on one side versus both. And so it's arthritis with severe joint pain and swelling, as you see in the image there, in the knees or other large joints. Onset is medium of 2 to 3 months after infection, rarely seen more than 6 months after infection. And it can occur, as I was saying, in the late winter months when exposure has occurred in the fall. Next slide, please. So we have the variety of presentation of symptoms. What should healthcare providers consider? And once an individual identifies, that they're not feeling well and they need to be evaluated, healthcare providers need to consider the signs and symptoms as well as the likelihood the patient has been exposed to infected black-legged ticks. So again, travel used to be, it's still part of the history that's important, but not critical, meaning that it's important to elicit if the person had traveled out of state, but also if they've had any outdoor activity locally even, given the risk of exposure, around our homes even. So other illnesses we want to consider, since they may also sometimes, if there's an allergic reaction or hives or a variety of skin or other flu-like symptoms that may present similarly to Lyme disease. And then of course, there's the need for diagnostic laboratory testing. And what that consists of most commonly is a 2-step testing process for Lyme disease. And both are required for some of the criteria and can be done using the same blood sample. Some other options that exist for Borrelia burgdorferi and for Borrelia mayonii include culture as well as PCR. That's more recently available and more widely available. And also a single confirmatory blood test can be done. Next slide, please. So once an exposure has occurred, there's a window of opportunity for post-exposure prophylaxis or preventive treatment. So, in areas that are highly endemic, which as shown earlier, Illinois thankfully is not. However, knowing if there was a potential exposure, many local healthcare providers will apply clinical discretion if there is a known exposure. A single prophylactic dose of doxycycline, which is 200 milligrams for adults, may be used to reduce, and there's pediatric dosing here as well, may be used, it's an option, so it may be used to reduce the risk of acquiring Lyme disease after the bite of a high-risk tick bite. So again, you want to weigh the pros and cons, and benefits may outweigh risks when all the following circumstances are present. So one is if the individual is, for example, not allergic to doxycycline, so it's not contraindicated. Also, if the attached tick can be identified as an adult or nymphal black-legged or deer tick, and if the estimated time of attachment is 36 hours or more, and if prophylaxis can be started within 72 hours or within 3 days of tick removal, because of that incubation period being 3 to 30 days. Ideally, you want to start it before infection may develop, again, to preempt development of infection. And then number 5 is Lyme disease is common in the county or state where the tick bite occurred. So again, we know we're not a high disease. We don't have a high incidence rate, but something to consider, certainly if someone had been, traveling to Wisconsin, but also if someone was exposed locally. Also important to note that antibiotic treatment following a tick bite from a prophylactic perspective is not recommended for anaplasmosis, babesiosis, or ehrlichiosis, Rocky Mountain spotted fever, or other rickettsial diseases. So Harvey mentioned this as well, that there are a variety of tick-borne diseases, And the only one that has this post-exposure prophylactic option is Lyme disease with that single dose of doxycycline. Next slide, please. So treatment, and I wanted to mention about post-exposure prophylaxis that really in that window, what needs to happen ideally is with that vigilance of, checking for ticks and all, is tick removal. And then if it's considered and administered, there's the prophylaxis, but whether or not the person receives prophylaxis, then symptom watch is important for the patient to kind of self-monitor, kind of like we're all used to doing with COVID-19, or just I feel like we all have increased awareness of each day, do I have, if you develop a symptom and then kind of thinking back to where we may have been or what we may have been exposed to, that absolutely applies to Lyme disease as well. So important to self-monitor and have that awareness on a daily basis toward early recognition and treatment. So if symptoms develop, then it's important to be evaluated. And if diagnostic testing also shows that Lyme disease is in fact what's causing the symptoms, then this table pretty much outlines the different regimens available and recommended for early localized and disseminated infection. There's a little variation in the range, and the dosing, of course, is adjusted between adults and children. And you'll see in the duration of days in the rightmost column, there's an asterisk for some of those. And that's explained in the red font under the table that says when different durations of antibiotics are shown to be effective for the treatment of Lyme disease, the shorter duration is preferred to minimize adverse effects, including infectious diarrhea and antimicrobial resistance. Basically the development of superbugs, that can outsmart antibiotics. And so we want to have the most effective course of antibiotic to get the benefit of it without increasing risk of resistance or adverse effects. Also, if anyone has if anyone does develop, or if it's unrecognized early on, for example, if they're in the 20 or 30% that didn't develop the erythema migrans, sort of hallmark rash symptom, and they progress to late Lyme disease, then up to 28 days of antibiotic therapy, oral or IV, may be recommended. The regimen may need to be adjusted depending on a person's age, medical history, underlying health conditions, pregnancy status, or allergies, and also important to consult with an infectious disease specialist regarding individual patient treatment decisions. And that's more for, again, treatment decisions, but also depending on the complications, especially if it's Lyme arthritis, might be helpful to consult with a rheumatologist as well. And then finally, the National Institute of Allergy and Infectious Diseases has done three placebo-controlled clinical trials on prolonged antibiotic therapy. And the results do show that there's no benefit from prolonged antibiotic therapy, meaning for months. Sometimes we'll hear of, IV antibiotics being administered kind of indiscriminately and not with a, targeted evidence-based course of treatment. And that can cause harm. And there are documented examples of adverse effects related to prolonged antibiotic therapy. And as I mentioned, several participants had serious adverse events associated with that prolonged IV antibiotic use. So what the guidance outlines, especially if it's that late disseminated stage or later disseminated stage, is up to 28 days. And then depending on the response, if there's some response and also based on clinical evaluation and at the clinician's discretion, a second course may be indicated or observation, but just not that sort of long-term indefinite antibiotic therapy. And there's more information at the link below in case anyone is interested. Next slide, please. So back to prevention. It's so true. Prevention is better than cure if we can have it. So just Harvey did a great job talking about prevention of tick bites. So just to circle back again from preventing tick bites in people, it can occur year-round. Tick exposure can occur year-round, But as we know, ticks are most active during the warmer months, which we are in the midst of between April and September. So we've got some tips here, and really, most importantly, day to day, being aware that we can even be exposed to ticks in our own yard or neighborhood, and taking those steps that Harvey walked through. And bottom line is we want to avoid contact with ticks. So avoid wooded or brushy areas with high grass and leaf litter. And when we do want to be in the outdoors in those areas that have, and we want to, live amongst, but avoid contact with ticks, we want to walk in the center of trails. So next slide, please. So here we've got just some of the resources that have more in-depth information from the Centers for Disease Control and Prevention, as well as the Illinois Department of Public Health and our very own DuPage County Health Department. The first link is our newsletter, our monthly newsletter that most recently in May of this year focused on Lyme disease. And then the second link is it has some of the resources that Harvey walked you through. And with that, thank you for your attention. And I think Harvey and I would be happy to address any questions.
Fantastic. Thank you so much. And again, I just want to let everybody know we've already gotten some questions in already, but feel free for anyone who's watching to ask some additional questions, either in the Q&A or the chat box. And if you're on Facebook Live, in the Facebook comments. So one of the first questions that I got was, can you just sum up chronic Lyme disease? Exactly what is it, and how does that fit within the particular phases that you just discussed, or is that considered to be something different?
It's a good question. I mean, there are just certainly, it's a sort of semantics, but there is a condition, some people refer to it as chronic Lyme disease, or it can be post-treatment Lyme disease syndrome, but nonetheless, it's and it's different for everyone. They may have different symptoms. It can lead to, again, arthritis or neurological symptoms. And so it's, again, important to, I would recommend evaluation, not only with your primary care physician, but then more specifically with either an infectious disease physician and or a rheumatologist to help address, or neurologist or cardiologist, depending on the manifestation of symptoms.
Okay. We definitely got a lot of questions in connection with pets. So first, can dogs actually get Lyme disease? And then when it comes to ticks, what should people be looking for when it comes to their pets? So maybe Dr. Chu, you could do the first one, and Harvey, you could do the second one.
Was the first one about, can dogs get Lyme disease?
Yeah, can dogs actually get Lyme disease?
That's a good question, because I'm a human physician versus a veterinarian. So actually, Harvey, are you able to address that one?
Yes, I believe they can.
Okay. And Harvey, I don't know if you know, are the symptoms very similar?
I really don't know.
Okay. That would be one we will follow up with a vet, and we will post that one on Facebook. What can people do in their yards to try to not be hospitable to ticks?
Well, I can take that first. The main thing is to keep the grass cut short because of the moisture issue. Ticks generally don't venture more than about 9 feet out into a lawn because they just can't tolerate the dryness. They like the taller grasses and the shrubs and things that where they can take advantage of the moisture. So keeping the grasses cut close, just regular grass height, can be probably the biggest thing that you can do in the lawn.
Okay. Now, for those of us that maybe have ornamental grasses and that type of thing, are those more likely to be places where ticks might reside, or?
Oh, they can be if you have anything like, I don't know, rabbits and things going in and out of there. One of the things you can do is to create barriers, like a 2 or 3 foot barrier of stone or mulch around those tall grass areas, between the tall, ornamental areas and the lawn areas, and that will create quite a moat for the ticks, that they won't be able to cross that easily, again, because of the moisture.
Okay. Now, one question, Doctor, is, do people recover from Lyme disease?
Yes, most do. Some do spontaneously, but the cure rate is very high, especially when treated.
Okay. And then how dangerous is Lyme disease when it comes to babies? So if, you're sitting outside with your child, maybe on a blanket or something along those lines, they wind up getting, maybe you see a tick or you get worried about a potential risk of exposure. What are the concerns for infant children?
It's a good question and very similar. I think often, and all the more reason to do a good tick check on especially younger children, because they not only, like the rest of us, may not be aware, but may not be able to, check themselves. So yes, very important to not only, identify and have early recognition and then evaluation diagnosis. And then there are treatment regimens that are dosed specifically for children.
Okay. And are there any, in terms of chronic long-term exposure risks, is there anything unique for infants as opposed to adults that we should be particularly worried about?
Probably, I don't know off the top of my head. I think it would be similar in similar risk-wise. And if anything, adults might be at a little higher risk, but generally the symptoms and the progression can be similar.
Okay. When it comes to, looking for any particular symptoms, obviously an adult, you can articulate certain things. If you're a kid, maybe you can't. Anything that, that as a parent, you should be kind of looking for, we talked about the rash, but anything else in particular in terms of symptoms for a kid or an infant?
Right. I mean, it would be difficult, especially if there's not a rash present, but I think knowing if there was a lot of outdoor exposure, or even just, say that one picnic or that one event, and if a fever is manifesting, with other, crankiness or irritability, and then it, especially given the time of the year that we're in, it makes sense to keep Lyme disease on our radar for evaluation.
One question too is when is it that ticks come out most often? Is it in the morning, evening, or any time of day? That's probably a question over to you, Harvey.
Well, I think they can be out any time of day, but it's generally when the hosts are going to be out.
Okay. And then what does the moisture? So if it's a wet morning or dry evening, is one more likely than the other?
Well, I think it's moist, not wet. So, a heavy dew, I doubt if there would be, a whole lot of them out in that. Okay.
And actually, now, one thing that you did mention is that it's actually very difficult for ticks to live inside your typical house. I mean, what type of humidity levels do we need to be looking at where your house would become inhospitable to a tick, even if you did happen to carry one in, say, on your pant leg or something along those lines?
Well, yes. I mean, if you get the normal house humidities, and if you can get below 60% relative humidity, that's going to start kind of cringing on the ticks. So you get down in the 40s, that's going to be a nice atmosphere that is going to be comfortable. Before that, you're going to get the static electricity. So people normally keep their houses between 40 and 60% humidity, and that would be just too low for the comfort of the ticks.
Okay. So then just out of curiosity, I mean, what do they do? Just shrivel up and die?
That's about it. Yeah, they they're pretty tough skinned bugs there, so they do actually shrivel up. Yes, they do.
Right. Dr. Chug, one of the things that you mentioned is that a lot of the exposure that we've seen in DuPage County, a good chunk of it has come from out-of-state exposure. Are there any particular states that we've identified as likely sources of where people are going, up to Wisconsin, over to Indiana?
Yeah, Wisconsin, I think, we haven't done a specific review of that recently, but just anecdotally, I know we come across a lot of folks that had, went to a cabin in Wisconsin for the weekend or something. So yeah, I'd say Wisconsin.
So then, one of the things, we looked at some of the close-up pictures of the tick, but, in reality, I mean, how how large are they really likely to be? I mean, are we looking at something maybe the size of a freckle, just a pinpoint? What kind of size really are we looking at in real life in terms of the types of things, particularly as a possible lead up into Lyme disease?
Yeah, it's really hard to distinguish some of the nymphs. Some of the most dangerous for Lyme disease are the nymphs, and when they come in, they're hard to distinguish sometimes from a freckle. Uh, but when the females take their final blood meals, they can get up to about a good quarter of an inch across.
I would just add that I think CDC had as part of one of their educational campaigns a few years ago, a picture of a poppy seed muffin. And they actually had a handful of nymphs on the poppy seed muffin, and they really blended in. So, so I would say analogous to a poppy seed.
Yeah, no, that's actually helpful. Or well, maybe since we're here in this part of the district, maybe the size of a poppy seed on a Portillo's hot dog. So there you
go. there you go. Yeah.
One question with regard to Lyme disease that we got in is, can it be transmitted from a pregnant mom to an unborn child?
Yes, unfortunately, there is that risk, and it can have severe outcomes. But thankfully, if the pregnant woman is treated with a course of doxycycline or with the antibiotic that they can tolerate, then there can be complete resolution with no adverse outcomes.
Okay. And then we did get a question as well as whether Lyme disease can be sexually transmitted from an infected person. I'm hoping the answer is no, but maybe you're going to tell me wrong.
You're correct. There is no evidence of Lyme disease being sexually transmitted or even person-to-person spread other than maternal child, through pregnancy transmission. But yeah, no, not sexually transmitted or not with physical contact.
Okay. Now, one of the things that, if you're a parent and, again, your children have been out in the woods or they have been playing outside, what's the easiest way to differentiate between a potential tick bite versus a mosquito bite? I don't know if that's one for
I can start. Okay. Oh, I
was Dr. Chu, that's fine with me.
Whoever. I can start, but Harvey's our entomologist, especially between the two of us. But I would say mosquito bites can typically have a little bit more of a local reaction. Tick bites don't always. There might be a little bit of a, area of redness or irritation from the tick bite initially, but that often wears off and isn't the sort of symptomatic erythema migrans. But Harvey, any thoughts on that or differentiating between the two?
I think you described it very well. The mosquito bite does have a little bit more of a welt that builds up sometimes. A bite from either one, you can get a little bit of redness around it, and that's not totally the rash that we're talking about that develops later on after some days, but that's just your initial irritation. Mosquito bites sometimes itch more. The turkey ticks, the Lone Star ticks, are supposed to have, a lot of those have an itch that is associated, but most of the time, like you described earlier, the saliva is kind of an anesthetic as it goes in, and you don't really feel the tick bite effect quite as much.
And then afterwards, I mean, is it one of those things where you can say every tick bite is likely to lead to a rash, or not necessarily?
Not necessarily. The majority do, but I think it's 70-80% do manifest with that erythema migraines, but not all of them. They may have generalized symptoms like the flu-like symptoms, or even develop some of the complications further on. Okay.
Now, one of the things, Harvey, that I thought you said that was fascinating was you said that they can have a blood meal for 1 year and then continue to survive. So is it that they don't have to have any other feedings at that point, or they just feed on something else?
Isn't it amazing? No, I mean, they can, ingest that protein and actually live on that for that period of time. They're just, slow moving and, purpose oriented. And when it's time to eat, they eat.
What's something that people should be looking for specifically when it comes to their pets, or are there any prevention steps that people can take with their pets?
I would say the main thing is to get a flea and tick protection from your veterinarian. I mean, there's a lot of over-the-counter stuff. I've always had dogs all my life, but it seems like the vets give you the good stuff. I don't know. I don't know. I don't know what it is, but there's very few ticks if you get a good quality flea and tick treatment for that. And then check your pets. I check our dog every day, so. It's just it's a bonding thing. Yeah.
Just out of curiosity, Dr. Chu, why is it that if they have to attach 36 to 48 hours or be attached 36 to 48 hours before the Lyme transmission? Is it because the Lyme transmission occurs like at a point of regurgitation and that's only at the very end?
It's a good question. I think it's just part of the cycle of like the duration of attachment before it does. I don't know, Harvey, do you understand the physiology of it a little better?
I understand it, or at least assume it the same way that you've just described it.
Okay.
So and I'm looking back at the slide about transmission. It is initially where there's that, where they secrete the saliva with the anesthetic properties, so the host, so that they kind of go undetected by the host. They don't kind of, brush them away. And then by the time they insert their feeding tube and they feed for several days. So yeah, it probably is a little bit with the exchange of the infection within the tick, or at least where they're carrying it. And then then it probably just takes that long for it to be transferred to the human host.
Right. And Harvey, you had mentioned that you don't want to squeeze the tick while you're removing it. Is it the same principle that you're essentially trying to keep as much of the tick components and parts separate from the human?
Exactly. Yeah, you're trying not to re-inject that contaminated blood back in, through the bite wound.
Okay. All right. Well, we are getting close to the end of our hour, so I'm going to do one more last call for anybody. We did get one more Q&A. Sorry. Yep. No, I think we got those as well. So if there are any more questions, feel free to put them in the chat box, or if you're on Facebook, go ahead and put them on there. Otherwise, I think that we have gone through a whole bunch of hopefully information you'll find useful. I certainly did. And I just want to encourage everybody again, if you have any questions, please reach out to our district office. I also want to very much again thank the DuPage County Health Department and our speakers tonight, Mr. Harvey Mull and Dr. Rashmi Chu, who have given us an incredible amount of information. We will be posting this on our website, and we can also help you find the forms or fill out forms if you reach out to our district office. And hopefully everybody will be able to go Lyme-free and never have to encounter this. So thank you so much to the people who are watching. Thank you to our speakers. And thank you,
Representative Mazzocchi.
Yes.
Sorry, I had a quick add-on. I just want to mention that the State Health Department has provided us with a couple hundred pocket cards with prevention information, and we're happy to share those with your office so you can share with anyone who would like them.
That would be great. We would love that. That'd be very helpful. And again, I very much appreciate as well the emphasis on prevention, early detection, and just trying to take these preventative measures to keep both yourself, your family, and absolutely the pets safe. So the last call for questions, seeing none, since we are at 7:30. This has been very helpful. So again, thank you so much, everybody. Have a great night.